Welcome back to the latest now on coronavirus. We are seeing a slight uptick in new daily cases as the so-called Delta variant continues spreading. And we're hearing about a possible need for a vaccine booster shot at some point. We are joined live once again by Dr. Jeff Potoff from UW Health. Doctor, appreciate your time this afternoon again. I want to start by asking about that slight uptick in new cases. I think you and I were talking about this just last week, given the holiday and all those gatherings that it might happen. How concerning is this uptick now that it's coming to fruition?
You know, we never like to see new cases of COVID-19. That means people are suffering, lives are being changed. But, not so surprising that we're seeing this. We still have a number of folks who are unvaccinated. And, that means there's people who are susceptible to this disease in our communities. And the Delta variant just makes it easier to catch it.
On the hospital end, doctor, how are we doing? Are we still in decent shape in terms of capacity and ability to treat those who do become severely ill?
We are doing okay in that regard. We've always had COVID patients, even during this downturn. We have a lot of other sick patients too, but for the most part, we're functioning within our normal operations. We're not doing things special like we were back last fall when we were really just trying to figure out where we could put the next patient with COVID.
Let's shift to the conversation to the vaccine. Wisconsin now at about 50% for those getting vaccinated. Let's talk about the need for a booster shot. We know Pfizer is working on a booster shot. They are saying it probably about a year out from vaccination. Right now, it seems the FDA is not ready to say that booster is needed. Where are you at on that?
Yeah, I think we'll see more researchers come together. So clearly, Pfizer has their clinical trials, but also there's, government-funded research to look into this question. The CDC and the FDA are looking at it. And all these minds will come together looking at all this data. And I feel like they'll make a pretty good decision on when is the right time for that booster. And then, we'll all sign up and get it and we'll move on. But right now, too early to give you a specific date.
Could there possibly be any harm in getting a booster, doctor, or what's the conversation about?
Yeah, you could have, side effects that happen. I think we want to understand that. And I think, the other, harm, if you want to call it, is, we still have most of the world to vaccinate. I don't think we want to avoid doing first round vaccination, which is really important, and then sequester doses for a booster that may or may not be needed yet.
Johnson & Johnson vaccine, doctor, is back in the news again. Let's talk a little about that. First, it was the possibility of blood clots, and now, rare as they may be, could be a side effect. Now, Guillain-Barré syndrome. Would you advise patients, if they have the choice, to avoid the J&J vaccine and perhaps get one of the others?
I don't know if I'd say that, because the adverse effects for all these vaccines are about the same. And the good news is they're all, incredibly low. It's just, your likelihood of getting these things is just so remote that I do think the best thing to do is to get vaccinated, as quickly as you can, wherever you get vaccinated, and not worry too much about these adverse events just because they're so rare.
Dr. Jeff Potoff from UW Health. Great to see you again, doctor. Appreciate your perspective as always.
Anytime.
Okay, a reminder, we have expanded coverage on coronavirus, including information about how to get vaccinated at tmj4.com/coronavirus.